Hello, everyone. Social distancing, self-isolation, is the right thing to do to stop COVID-19 from spreading. But the longer it continues, the longer the stress, anxiety, frustrations starts building up in us. First, let's divide each individual, common, psychological and behavioral responses in general population. Anxiety, worry, fear, contamination about uncertain future. Health concerns for self or loved ones. Anger, increased conflicts with family. Anger, irritability regarding irresponsible behavior in society. Low or irritable mood. Concentration, difficulties, or impairments in daily performance. Sleep disturbances. Hypochondriacal, fear regarding cough, sore throat, or fever. Irresistible urge to touch mouth, face. Increased use of alcohol and tobacco. A proportion of individuals will go on to develop syndromal disorders, such as depression, anxiety, or trauma-related disorders that require formal treatment. Hoarding of protective equipment and survival items. Undue attention to unsubstantiated facts in news and social media. Infected cases. Fear and avoidance of reporting due to stigma, isolation. Undue guilt on having indulged in behavior leading to infection. Guilt on being responsible for spread of infection. Anxiety and panic about worst possible outcomes. Worry about safety and well-being of family members. Quarantined and suspected case. Boredom and loneliness. Fear about health of family members. Guilt of being a source of infection or possible infection. Guilt of not being able to perform duty or assigned role in crucial times. Healthcare workers. Anxiety about magnitude of cases and ill-equipped working environment. Anxiety about individual role and competence, or training for the same. Burnout due to long working hours, critically ill patients and deaths. Sense of failure, frustration, poor self-care, blaming, irritability, giving up, etc. Secondary traumatic stress. Undue worry about something bad happening, exaggerated startle, anxiety, nightmares, etc. Lack of adequate caution due to altruistic zeal. How to tackle stress? How can we keep sanity in check? How can we stay enthusiastic and active all the time? Here are the tips for mental well-being. 1. Acknowledge feelings and share. 2. Awareness of realistic information and reliable sources. 3. Avoid speculation and rumors. 4. Adherence to hand hygiene and social distancing. 5. Be physically active, have balanced diet. 6. Be a role model for children and neighbors. 7. Break chain of rumors. 8. Balance work and leisure. 9. Communicate with empathy and allow expression of feelings. 10. Care for elderly. 11. Cultivate hobbies and routine to tide through tough times. 12. Cautious approach towards spread of infection. 13. Chat and e-socialize for continued connection with people. Additional tips for healthcare workers. Prepare in advance, mock training and drill. Get or have clarity of role. Regular risk assessment and critical incident debriefing. Effective buddy system to ventilate and express. Take healthy breaks and healthy diet. Look for signs of burnout and stress. For early intervention, cultivate cautious calmness. Avoid or Limit use of caffeine and alcohol. Keep an eye on each other. It is not selfish to take breaks. Whenever you feel like working all the time does not mean your best contribution. There are other people whom you can rely on for the assistance. Create an active and fun-filled environment around. Be happy. Stay healthy. Sincere thanks to Dr. Medhawe Agrawal for assistance in curating this topic. Please subscribe to my channel to stay updated and to get more information on daily healthy trends, concerns. Click on the bell button to subscribe.
Thank you.